Welcome to our channel MCQ1. In today's topic we will going to cover RRB Nursing MCQ. So let's start the video. Which neurotransmitter is most commonly associated with deficiency in depression? Dopamine, acetylcholine, serotonin, GABA. The correct answer is option C, serotonin. What is the typical size of an intravenous cannula used for neonates? 18 gauge, 22 gauge, 24 gauge, 16 gauge. The correct answer is option C, 24 gauge. In the first week of life, newborns typically gain weight, lose weight, maintain the same weight, double their weight. The correct answer is option B, lose weight. What percentage of their birth weight do newborns typically lose in the first week? 1 to 2%, 3 to 5%, 5 to 10%, 10 to 15%. The correct answer is option C, 5 to 10%. Which of the following is a classic symptom of meningitis? Seizures, photophobia, hydrophobia, none of these. The correct answer is option B, photophobia. Graves' disease is characterized by the overproduction of which hormone? Cortisol, insulin, thyroxine, melatonin. The correct answer is option C, thyroxine. Which of these medications is commonly used to treat Parkinson's disease? Metformin, levodopa, vancomycin, lorazepam. The correct answer is option B, levodopa. What is the primary role of levodopa in the management of Parkinson's disease? Increase dopamine levels, reduce serotonin levels, block dopamine receptors, none of the above. The correct answer is option A, increase dopamine levels. Which of these drugs is often combined with levodopa to prevent its breakdown before reaching the brain? Diazepam, carbidopa, levodopa, vancomycin. The correct answer is option B, carbidopa. What is the most common type of kidney stone in nephrolithiasis? Magnesium stone, calcium oxalate stone, uric acid stone, none of the above. The correct answer is option B, calcium oxalate stone. What does the presence of 10 to 15 pus cell per high power field in urine typically indicate? Normal finding, urinary tract infection, dehydration, kidney stones. The correct answer is option B, urinary tract infection. Which of the following immune system responses is responsible for causing fever? Increased insulin production, production of pyrogens, decreased white blood cell count, increased melatonin secretion. The correct answer is option B, production of pyrogens. Which diagnostic test is commonly used to confirm myasthenia gravis? MRI, CT scan, electromyography, blood culture. The correct answer is option C, electromyography EMG. What is the first line treatment for trigeminal neuralgia? Antidepressants, anticonvulsants, opioid pain medication, non-steroidal anti-inflammatory drugs. The correct answer is option B, anticonvulsants. Which part of the brain is primarily affected in Parkinson's disease? Cerebellum, basal ganglia, hippocampus, cerebral cortex. The correct answer is option B, basal ganglia. Which diagnostic test is commonly used to confirm streptococcal pharyngitis? Blood culture, throat culture, urinalysis, chest X-ray. The correct answer is option B, throat culture. Which of the following types of cataract is associated with aging and occurs gradually over time? congenital cataract, traumatic cataract, nuclear sclerotic cataract, posterior subcapsular cataract. The correct answer is option C, nuclear sclerotic cataract. What is the term used to describe a bluish discoloration of the skin caused by a lack of oxygen? Cyanosis, jaundice, failure, arrhythmia. The correct answer is option A, cyanosis. Which of the following is a common side effect of electroconvulsive therapy? Persistent high blood pressure, memory loss and confusion, increased risk of stroke, severe joint pain. The correct answer is option B, memory loss and confusion. Cold therapy should not be applied when there is swelling, inflammation, impaired circulation, pain. The correct answer is option C, impaired circulation. Which of the following hormones is primarily responsible for increasing blood pressure? Insulin, cortisol, aldosterone, oxytocin. The correct answer is option C, aldosterone. Which structure in the ear is responsible for detecting rotational movement of the head? Cochlea, Eustachian tube, semicircular canals, none of the above. The correct answer is option C, semicircular canals. Which medication is used to treat angina pectoris? Nitroglycerin, aspirin, diazepam, lorazepam. The correct answer is option A, nitroglycerin. A patient is assessed with the Braden scale and scores an 8. What does this score indicate about the patient's risk of developing a pressure ulcer? No risk, mild risk, moderate risk, very high risk. The correct answer is option D, very high risk. A nurse obtained a client's pulse and found the rate to be above normal. The nurse documents these findings as bradycardia, tachycardia, arrhythmia, bradypnea. The correct answer is option B, tachycardia. Capillary refill can be used as part of the assessment for which medical condition? Stroke, heart attack, shock, asthma. The correct answer is option C, shock. Which one of the following terms is used to describe loss of appetite? Dysphagia, anorexia, dyspepsia, cachexia. The correct answer is option B, anorexia. What is the primary goal of emergency management in spinal cord injury? To reduce swelling in the limbs, to stabilize the spine and prevent further injury, to assess neurological function, to increase blood flow to the affected area. The correct answer is option B, to stabilize the spine and prevent further injury. Which type of stroke is characterized by a temporary interruption of blood flow to the brain? Ischemic stroke, hemorrhagic stroke, transient ischemic attack, none of the above. The correct answer is option C, transient ischemic attack. What is the term for the formation of a pocket of pus within the bone in osteomyelitis? Abscess, fistula, cyst, hematoma. The correct answer is option A, abscess. Thanks for watching. Subscribe MCQs 1 for latest informative MCQs.